I wish to give warm thanks to the organizing committee at the Hospital Isabel Zendal, to the local governments of the Autonomous Community of Madrid and its president, Her Excellency Ms. Isabel Ayuso, and to Mr. Fernando Prados, General Manager of the Hospital Zendal, and the Teofilo Hernando Foundation, who are coordinating the technical and administrative secretariat for this event. Thank you all for having invited me to this inspiring exchange so that I can share with you our journey of building a COVID-19 hospital in Nairobi. This hospital, the United Nations Nairobi Hospital COVID-19 facility, serves the United Nations family in the entire region and beyond, as well as the citizens of Kenya. There is an African proverb which says, if you want to travel fast, walk alone. But if you want to make a difference, take others with you. Please allow me to share our journey with you. Ever since the COVID-19 pandemic began in early 2020, we have witnessed its devastating impact across the globe, wreaking havoc in countries and territories, among communities, families, and individuals. Beyond the direct physical and mental health impact, COVID-19 has greatly affected global economies and the basic livelihood of countless people. You have suffered this in Spain and across all of Europe, and we have experienced the same in Africa. In Kenya, the first case of COVID-19 was detected back in March 2020, when so much was still unknown about the virus, the cause, how it spreads, and how individuals and organizations could respond to what has proven to be the greatest health threat of our time. In its efforts to manage the evolving pandemic, the Kenyan government implemented stringent requirements for incoming travelers, and medical evacuation cases. These requirements included mandatory quarantine, testing, and institutional isolation for travelers found to be COVID-19 patients. This was compounded by widespread restrictions on access to the national airspace. The restrictions were particularly significant for us, since Nairobi is a regional medical evacuation hub for the United Nations personnel. Initially, COVID-related medical evacuations were not approved to enter Kenya, and all non-COVID medical evacuations had to be screened for COVID-19 before they were allowed to enter the territory. While many countries were reeling from the disease, at the same time, there was a positive development that was emerging worldwide. We began to see increased collaborations between research institutions and governments, and local and global health organizations as they began to combine their efforts in order to stem the pandemic. Within Kenya, this collaboration could be seen in intense consultations with various stakeholders, such as governments of Kenya, the World Health Organization, United Nations Headquarters Medical Team, UNICEF, and amongst others, the UN family in Kenya. We held regular crisis meetings to discuss the evolving situation and to exchange views and knowledge. Having seen what was taking shape in Europe and other regions at the time, it was clear that specialized resources and capacity building would be required for Kenya. Significant gaps were identified, mainly in a number of available critical care and isolation facilities, particularly outside Nairobi. Even within Nairobi, there were limitations in first, the number of ventilators, secondly, infectious disease units, thirdly, beds in intensive care units, and finally, units for intensive respiratory care. It was clear that much more will be required if we were to experience the tsunami of infection that we were witnessing elsewhere in the world. The silver lining, however, was that in Kenya, we were fortunate to have highly experienced specialists, even though the numbers of these specialists still fell short of the anticipated requirements. At the early stages of the COVID-19 pandemic, UN Secretary General Antonio Guterres began formulating a system-wide COVID-19 medivac solution that will establish structures and procedures to grant United Nations personnel and other humanitarian workers access to necessary evacuation and treatment options as part of our duty of care. It will also enable the continuity of critical humanitarian programs, which were seriously constrained by global travel restrictions. In Kenya, the United Nations sought to secure access to medical evacuation, quarantine, isolation, and treatment facilities for UN patients and their dependents, and humanitarian personnel, in line with this Medivac framework. My team and I held negotiations with the Kenyan government, and we successfully managed to agree on Medivacs into Kenya on a case-by-case basis. Later, in September 2020, we also negotiated a special protocol which made it possible to ease the functioning of the United Nations operations across the country, and also greatly ease the facilitation of incoming COVID-19 medivacs. The United Nations also obtained access to the required services. Now, with the full knowledge of the gaps in the COVID-19 response and the lack of facilities to cater specifically to the virus, the Secretary General decided that the United Nations should build a COVID-19 hospital in Nairobi, the first specialized hospital that will respond to the pandemic in the region. Spearheaded by the United Nations office at Nairobi, the UN system began pursuing multiple avenues to establish this dedicated COVID-19 treatment facility in Kenya. We envision a partnership with existing private hospitals already handling UN patients. This approach will save on the need for bottom-up investments in new medical facilities and personnel. We looked at all the options and identified the Nairobi Hospital, a premier private multi-specialty hospital in Kenya. Working closely with the United Nations Department of Operational Support, the United Nations Office of Legal Affairs, and with the governments of Kenya and the Nairobi Hospital, we embarked on building our plan to life. The Nairobi Hospital has a long history of caring for United Nations personnel and their dependents, and thankfully, it also had the physical facilities that could be utilized to carry the projects forward, while taking advantage of the economies of scale already present at the main facilities. The actual care of patients at the envisioned facility will remain under the clinical leadership of the Nairobi Hospital, with close oversight provided by the United Nations Office in Nairobi, Joint Medical Service in Nairobi, and the UNON management. The projects of establishing the facility included 3 key project elements. 1, the construction. Secondly, the procurement of medical equipment. And finally, the human resource and staffing aspects. The road to our journey was certainly paved with hard stones. However, all efforts paid off, and we finally established the United Nations Nairobi Hospital facility, successfully completing it in 3 months at a cost of approximately $8 million United States dollars. It was officially launched by the Kenya Head of State, President Uhuru Kenyatta, on 13 November 2020. The 100-bed UN Nairobi Hospital COVID facility has 15 ICU beds, 45 HDU beds, and 40 general ward beds. Of note, all 100 beds at the facility are equipped with the infrastructure required to allow them to be immediately converted into ICU beds. One unique feature of this facility is that it has the capacity to treat severe COVID-19 patients using ECMO technology, which supplies the blood of a patient with additional oxygen. Very importantly, this represents the first equipment of its kind in all of East and Central Africa. Due to the continuous scarcity of dedicated COVID-19 resources in Kenya, after the establishment of the UN Nairobi Hospital COVID-19 facility, it quickly became apparent that this unique resource will also be of added value to the Kenyan population who required treatment for COVID-19, augmenting the medical capacity in the host country. As such, an admission protocol was agreed between the Nairobi Hospital and the United Nations to broaden the scope of who could receive care at the facility while maintaining a number of beds for United Nations personnel and their dependents. Since its completion, the United Nations Nairobi facility has taken care of about 800 COVID-19 patients, United Nations and non-United Nations, including over 100 UN evacuees. The United Nations Nairobi Hospital facility has indeed turned out to be the go-to facility for the UN COVID-19 evacuees. It is worth noting that UN Medivac patients who have been admitted have come from as far as Afghanistan, Nepal and Yemen, and as near as our neighboring countries including Somalia, Tanzania, thus serving colleagues from a wide geographical scope than first expected. Kenya has experienced 3 major COVID-19 waves to date. This has been reflected at the hospital with periods of enhanced patient admission with bed occupancy, occasionally above 80%. The facility has continued to provide medical care to complex cases of COVID-19 infection with local specialist support. The involvement of the United Nations with the COVID-19 facility continues with the provision of support and oversight in the context of a very collaborative partnership. This support and oversight have involved the UNON Joint Medical Service, the United Nations Medivac Cell Unit in Geneva, and multiple other stakeholders to ensure continuous optimal care and follow-up of United Nations personnel and dependents. This journey has followed an African proverb. We envision a dream, measuring what we could do from my office to make a difference, and we then began a challenging journey with the rest of the United Nations system, the Nairobi Hospital, and the government of Kenya to make a significant difference in healthcare for our colleagues and our host country during these challenging historical times. I thank you for your attention and wish you every success in this important meeting.